Hello everyone, I am Dr. ZIyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this introduction video, we will see what is CPT coding and the purpose of it, the differences between ICD-10-CM versus CPT, and the categories modifiers of the CPT, and how to find the CPT codes in the codebook with real demonstration. Okay, what is CPT? CPT coding refers to the use of current procedural terminology codes, that is CPT, a standardized medical code set created and maintained by the American Medical Association (AMA). These codes are essential for describing medical, surgical, and diagnostic services performed by the healthcare professionals. The CPT code set is updated annually to incorporate new procedures, technologies, and changes in medical practice. What is the purpose of CPT? 1. Uniform language. CPT codes provide universal language that allows healthcare providers, payers such as insurance companies, government programs like Medicare or Medicaid, and other stakeholders to communicate consistently about the medical services and procedures rendered. Second, billing and reimbursement. This is the primary function of CPT code. Healthcare providers use these codes on their claims to describe the specific services they provided to patients, enabling accurate billing and reimbursement from insurance companies. Without correct CPT coding, claims can be denied, leading to revenue loss for providers. Third, data collection and analysis. CPT codes are crucial for collecting and analyzing healthcare data. This data is used for research, studying trends, medical procedures and outcome, healthcare planning, such as understanding healthcare utilization and resource allocation, quality measurement, evaluating the quality of care provided, performance measurement, tracking specific clinical actions for quality improvement initiative. And fourth one is administrative management. CPT codes streamline administrative processes such as claims processing, developing guidelines for medical care review, and managing healthcare costs. Okay, what is the difference between ICD-10-CM and CPT? The CPT codes work in tandem with ICD-10-CM codes, which means the ICD-10-CM codes describe the diagnosis, that is, the why the patient is being seen or treated. CPT codes describes the procedures and services performed, the what was done for the patient. Both are necessary for a complete and accurate picture of the patient's encounter and for proper billing. For example, the claim might include an ICD-10-CM code for acute appendicitis, that is diagnosis, and a CPT code for appendicectomy, that is the procedure. What are the categories of CPT code? Category 1 codes. These are the most common and widely used CPT codes. They describe distinct medical procedures or services performed by qualified healthcare professionals. They are 5-digit numeric codes. The CPT Category 1 codes are divided into 6 main sections. First one is evaluation and management, then anesthesiology, surgery, radiology, pathology and laboratory, medicine. So I will show these when I demonstrate the book. And Category 2 codes. These are optional alphanumeric tracking codes used primarily for performance measurement and quality improvement. They are not directly linked to reimbursement but help collect data on specific clinical actions. Example, patient education, screening test. They have 5 digits followed by letter F. For example, 1000 F for patient history, tobacco use. Category 3 codes. These are temporary alphanumeric codes for new and developing technology, procedures, and services. They are used for data collection and assessment of emerging services that do not yet meet the criteria for a Category 1 code. They help track the use of new technologies and can sometimes be used for payment. They have 4 digits followed by letter T, example 0042T. In addition to these 3 categories, another new category is property laboratory analysis, PLA codes. These codes describe proprietary laboratory analysis, PLA codes. These codes describe proprietary clinical laboratory analyzers often developed by a single lab or licensed multiple labs. They were recently added to the CPT code set. They have 4 digits followed by the letter U. Example here. So other than these codes, there are some modifiers. So what are CPT modifiers? In addition to the 5-character CPT codes, 2-character modifiers, those are numeric or alphanumeric, can be appended to provide further information about the service or procedure without changing its meaning. Modifiers explain specific circumstances that altered or enhanced the service performed. For example, the common modifier uses are 50. It indicates a bilateral procedure. Example, a procedure performed on both sides of the body. 51 is describing the multiple procedures were performed during the same encounter. F1 is identifying the anatomical location, example left or right or specific finger. 53 is explaining that a service was partially reduced or discontinued. So let's go through the CPT book and you can understand more what I have explained up to now. Okay, let's go to the CPT code book. So this is the front cover of the code book. When you open the book, the back side of the front cover will have the symbols, then modifiers, then category 2 modifiers, anesthesia physical modifiers, modifiers approved for hospital outpatient use. So these are very important. That is available at the back side of the front page. Then you will have the tabs, that is bookmarking tabs for the CPT book. So you can easily remove the tabs and you can bookmark as like this. So I have already done the bookmarking. So when you open other pages, this is the place of service codes for professional claims and the disclaimer notes and about CPT. Then you will have the contents. So it will list the contents of the book. Then it will give the introduction to the CPT book. After the introduction, you will get the illustrated anatomical and procedural reviews. Then you will have the anatomical plan picture. Then you will have the very important summary, that is evaluation and management tables. This is very important. I will explain this in detail when you go for the guideline classes. So this is for the office or outpatient service, initial hospital inpatient, home residency. So those kind of things are there. I will explain in detail when we start the guideline tutorial. So after that, you will have the evaluation and management services guideline, EM guidelines. As I mentioned earlier, category 1 have main 6 chapters. That is, the first one is the evaluation and management EM service guidelines. After that, you will get the anesthesia guidelines. So this is marked in different color, you can see. After that, you will get the category 2 third chapter, that is surgery guideline. The surgery guideline is the biggest chapter in the category 2. You can see this green bookmark ones are surgery coding here. So each system you will have the coding. For example, the first part is the intergovernmental system. You can see intergovernmental procedures and their coding. After that, muscular system. You can see muscular system coding. Then the surgery of the respiratory system. You can see the respiratory system details. And the surgery of cardiovascular system with the images. After that, you will get the digestive system. So likewise, you will get the surgery part will have all the anatomical system with the procedures listed there. So this is urinary system, then the endocrine system, nervous system, and ocular and auditory, eye and ocular adnexia. So those kind of things you can have. So those all are belong to the surgery category. After that, you will get the radiology guideline with the radiology codes. Then you will get the pathology and laboratory guidelines with the laboratory codes. Pathology and laboratory codes here. It's also a big chapter. After that, you will have the medicine guidelines with the medicine codes. You can see here, vaccine peroxide. So those kind of things are. This also another big chapter here. So after the medicine, then you will get the category 2 codes. You can see here the category 2 codes with the 4 numerical and 1 alpha digital code. And the category 3 codes here, you can see those are similar to category 2 codes. Then you will have the appendix. So appendix, you will get appendix A to T. So appendix A is the description of modifier. As I showed earlier, modifiers in the back side of the front cover. The detailed description of the modifier available at the appendix A. Then you can go through the appendixes. You can see up to T, the appendix is available. After the appendixes, you will get the index. So index is also very important to find the CPT code. So you can see this is the index of the CPT code book. Okay, this is the superficial go through of the CPT code book. When you look at the CPT code symbols closer look, the following is the list of code symbols used and what they mean in CPT code. This red dot is for new code. This triangle is for revised code. This plus icon is very important one. It's for add-on code. This mark is for modifier 51 exempt. This green triangle, 2 triangles contain new or revised text. This star for telemedicine and this hash is for the resequenced code. So this kind of symbol you have to know. When you start coding, you will be familiar with these symbols. How to code using CPT codebook. So there are many general guidelines and chapter specific guidelines are available. So you'll be learn those things in a guideline tutorials. But in the introductory part, I am specifically stressing very common two things. One is semicolon, other one is add-on colon. So an established set of conventions and symbols is used throughout the CPT codebook as follows. Semicolon, this icon, an intended procedure, a CPT procedure or service code that contains a semicolon is divided into two parts, the description before and after the semicolon. A. The words before the semicolon are considered the common procedure in the code descriptor. B. The intended description is dependent on the preceding common procedure code descriptor. C. It is not necessary to report the main code when reporting the intended codes. So I'll show you what it is mean. So in the CPT codebook, let's take this code 00160. It says anesthesia for procedures on nose and accessory sinuses, semicolon, not otherwise specified. So as I mentioned earlier, after the semicolon, you have to read other codes. For example, 00162 is radial surgery. So that means anesthesia for procedures on nose and accessory sinuses, radical surgery. 00164 means anesthesia for procedures on nose and accessory sinuses, biopsy soft tissue. So if the procedure says anesthesia for procedure on nose and accessory sinus with biopsy and soft tissue, you have to code only this code, that is 00164. That is what meant in the description sheet. It is not necessary to report the main code when reporting the intended codes. This is the very common item you are facing in the CPT codebook, that is semicolon. Other one is add-on codes. So some procedures identified with a plus symbol are commonly carried out in addition to a primary procedure. Add-on codes must be used with their specific primary procedure. See parenthetical notes listed below the code description. Let's see an example. Let's take this example, removal of skin tags, 11,200. Removal of skin tags, multiple fibrocutaneous tags, any area, semicolon, up to and including 15 lesions. Next code says plus 11,201, each additional 10 lesions or part thereof. Within bracket, the parenthetical note says list separately in addition to code for primary procedure. So let's say if the number of skin tag remove is 20, so how would you code this? So here you have to code up to 50 lesion, 11,200. So removal of skin tags, multiple fibrogenous tags, any area up to and including 50 lesions. So if it is more than 50 lesions, then you have to add the other code 11,201 for each additional 10 lesions. So the correct code will be 11,200 plus 11,201. So up to 10 lesions. That is mean up to 25 you have to code this. If it is 35, again you have to multiply this code by 2. If it is 45, you have to multiply by 3. Like that is go on. So we'll be discuss those things in detail in guideline class or when we do in the questions. Okay, let's see how to find CPT code in the CPT codebook with the real examples. The most effective way to find CPT code is to use a systematic approach, often referred as the index first, then verify in tabular method. So the step 1 is identify the main term or terms in the CPT index. The CPT codebook has an alphabetic index at the back. This is your starting point. Think about the key services or procedures performed. For example, what was the procedure or service? Example, repair, removal, insertion, excision, consultation, examination. What anatomical site was involved? Example, knee, heart, stomach, lung, like that. What was the condition or diagnosis, if relevant to the procedure? Example, fracture, tumor, like that. What instrument or method was used? Example, laparoscope, ultrasound, arthroscopy, like that. And what was the eponym, if applicable? For example, NAS procedure, mouth surgery, like that. But in the CPC examination, you can use the elimination method with the 4 answers. I'll demonstrate you in the examination questions. Okay, the step 2 is note the code ranges from the index. The index will provide a single code or ranges codes. Example, 29,872, 29,882. That are potential matches for your main term. Step 3, go to the tabular section, that is main body of the book, and locate the code range. This is where you will find the full description of the codes. Step 4 is read the full code description and associated guidelines. First, verify the exact procedure. Does the code description precisely match the service documented? Check for indented codes. If there are indented codes, read them carefully to see if a more specific code applies. Remember the semicolon rule. Also, review parenthetical notes. These notes often provide crucial information such as do not report with or use also, like that. Finally, look for section specific guidelines. At the beginning of each major section, surgery, radiology, etc., there are guidelines that define terms, provide coding instructions, and specify circumstances for reporting certain codes. These are extremely important and often overlooked. Let's see a real example. Scenario 1, patient underwent an appendectomy for acute appendicitis. So here the steps is we have to find the main term. The main term is appendectomy or appendicectomy, or else you can use appendix excision. Both ways you can search the term. In the alphabetic index, look up for appendectomy. Let's see how to do this. Okay, now I am at the CPT alphabetic index. Here you can search for the alphabetic index of appendectomy. Then you can go to the appendix excision 44950, 955, 960. You can go back the tabular list and confirm, or else you can search other way. Here appendix, then excision. Again, it will give you the same set of codes. So both ways you can search. So for this demonstration, I am using this appendectomy, appendix excision. So let's start this course 44950. So here excision 44950 is appendectomy. So within bracket it says incidental appendicectomy during intra-abdominal surgery does not usually warrant separate identification. If necessary to report at modify 52. Then 44955 is when done for indicated purpose at the time of major procedure. 44960 is for ruptured appendix with abscess or generalized peritonitis. But in our case, it just says appendix. Patient underwent appendectomy for acute appendicitis. So the correct code will be code 44950. So the correct code will be 44950. Second scenario is laparoscopic cholecystectomy performed for chronic cholecystitis. So here the main term is the procedure done here is cholecystectomy, or you can search for gallbladder excision. Both ways you can search. So we have to go to the alphabetic index, look at cholecystectomy. Then you have to search for the laparoscopic. So when you search the alphabetic index, you can see this is cholecystectomy. First subheading is any method, then donor liver, then excision, then laparoscopic. So our one is laparoscopic cholecystectomy. So in the laparoscopic part, it gives you 47,562 to 47,564. So there's a code range is given. So you have to go to the tabular list and confirm the answer. So let's go to the tabular list. You can see here laparoscopy surgical cholecystectomy. So this is our procedure. Laparoscopy surgical, then semicolon cholecystectomy, then cholecystectomy with cholangiography, cholecystectomy with exploration. So our procedure is 47,564. That is laparoscopy surgery cholecystectomy. So the most appropriate code is 47,562. There's no need of modifiers. So this is the answer for this scenario. The third scenario is evaluation and management type of question. So an established patient seen in the office for follow-up of hypertension. Review of systems, physical examination, and medical decision making reflect a moderate complexity visit. So here the main term is evaluation and management, that is EM codes. So EM codes are usually grouped at the beginning of the CPT book. Then you have to find the office visit and established patient. So if you're using the alphabetic index, you can go directly to the EM section, but the index can point you the office or other outpatient services. So I'll show you the index method. So when you go to the index, you have to search for the office, endo, other outpatient services, and patient is established. So this established patient. So if you have to go to the code series of 99,211 to 250. So let's go to the code series here. For evaluation management types questions, you need to consider the three key components. But one is history, then examination, then medical decision making or time. In this case, this is moderate complexity. So you have to go to the moderate complexity level. So you can see the 212 is office or other outpatient visit of the evaluation and management of established patient, which requires a medically appropriate history and examination with straightforward medical decision. Here is straightforward medical decision. 213 is low level medical decision making, but in our case is moderate. So let's go down. and check here the moderate level of medical history is taking here. So office or other outpatient visit for the evaluation and management of established patient with requires a medically appropriate history or examination and moderate level of medical decision making. So the correct code will be 214. So the correct code will be 99,214. But it is easy if you encounter this evaluation management type of question, you can directly go to the section, and before start of the section there's a table. So with the table you can easily identify the answer. So here you can see patient is established patient, office visit, moderate complexity. So you have to keep these three in mind: established patient, office visit, moderate complexity. So you can use this table at the start point of the evaluation and management section. This is the evaluation and management tables. Here you can see office or other outpatient services, and this is new patient, this is established patient. Like that you can have other tables for hospital inpatient, the nursing care facility, resident services, pediatric care. So all categories are having tables. So in our case, here the patient encountered at the office and patient is established patient. So you can go to this table, established. Here the decision making is moderate. So you can see medically appropriate history and examination, and decision making level is moderate. So moderate patient level of decision making is 99,214. So using these tables also you can easily find the answer. Scenario number 4. This is a procedure on specific body part. Example, excision of a benign lesion 1.5 centimeter diameter from the patient's back. So here the main term is you could start with excision or lesion, but also consider the body part, that is skin or back. So starting the procedure with excision is often efficient. So let's check in the alphabetic index. So here first we have to search the main term, that is excision, then go to the subterm lesion. So that also arranged in alphabetic way. So this is A. So let's go down further. So here lesion. So excision, the subterm lesion. Then we can go to the another subterm skin. So here skin. Within that you can go for benign or malignant. In this case it is benign. So benign codes are start from 11,400 to it's go on. So you can start from here. So let's go to the tabular list. So once you come, you can see this is the benign lesions. So you can see benign lesion 11,400 is excision, benign lesion including margins except skin tech, unless listed elsewhere, trunk, arms, legs. So our part, that is back, is called trunk. So trunk is here. The excised diameter 0.5 centimeter or less. In our case it is 1.5 centimeter. So this code is not possible. Let's go to other one. 11,401 excised diameter 0.6 to 1 centimeter. So you have to read this code from this semicolon. The other one is 11,402 is excised diameter 11.1 to 2 centimeter. So in this code you have to read as like this: excision, benign lesion including margins except skin tag, trunk, arms or legs, then excised diameter 1.1 to 2 centimeter. So our one is lesion is 1.5 diameter. So correct code will be 11,402. So this is how you can find the code in CPT codebook. So this is just the introduction. You can learn more complex examples in my other tutorials. So please check my playlist for more examples and more explanations. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.